Hello, good afternoon. I would like to demonstrate the PAAS blood glucose monitor to you today. The first thing you need to bear in mind, or the first thing you need to do before you do your blood glucose test, is to make sure that your hands are clean, so you've washed your hands and they're nicely dried. Because if you don't wash your hands and you have any dirt on your fingers, it can influence your results. So let's have a look at what's inside the PAAS blood glucose monitor. You have your manual, which has a lot of information on how to use the system. It's a very, very easy system to use. That's the case, quite a durable case, keeps your meter safe. So let's look at the contents. You have your PAAS BG. It comes with some test strips. You have 10 in this pot. You have your lancing device. And inside here, you have your needles or lancets. So let's go ahead and do a test. Let's pop this to one side for now. So again, it's a very simple system to use. All you need to do is grab before we put a test strip in the meter, what I want us to do first is to make sure that we have a lancet in here. So let's open that up. So we need to put a lancet in the pen. Inside, push that in, and then twist that off, and then replace the cap back on. Now, what I will suggest is that in terms of the depth setting, what you want, it goes from 1 to 5, but I would say 2 should be okay. It's really down to your technique, and I'll show you that in a second once I do a test. So we're going to pull this back to prime it. That's ready. Now we're going to grab a test strip to put inside the meter. One tip is, you notice I closed the test strip. Always make sure you do that once you take a test strip out. Put that to one side. Now this is an automatic system, which means that once you put a test strip inside, it should come on, and as you can see, it's on. Any second from now, it's going to flash, as you can see there, requesting for blood to be put in. So let's get some blood. Now, regarding your technique, what you want to do when taking blood is usually to avoid taking the blood from the pads, if you like, because over time, the more tests you do, and as you get older, you might start to lose some sensitivity from these bits. So it's always advisable to use the side of the finger. Now, a good technique to do is not just to do this, but instead to put your thumb against the finger, press it, and by doing so, it makes the skin a little bit harder there, so that when you put a pen, your lancing device there, it's easier for the blood to come out. So let's go for that. So milk it if you like, if you have an adequate blood, and then just put the test strip against the blood, and that counts down from 5 to 0 and should have a result. So my result there, as you can see, is 110 milligrams per deciliter, and that's pretty much it really. So you can see how very easy it is to use. The PAAS blood glucose meter has a very unique function, which is an ejector function at the back here. I'm going to use this as my sharp spin, and all you need to do is just push this button down, and that will eject the test strip. So that really eliminates the risk of cross-infection by handling the test strip itself. The PAAS BG also has a good memory, and also can keep 7 days, 14 days, and 28 days averages on the system. And that's it. Thank you for listening.